CataractCoach.com. This is my scrub tech setting up for cataract surgery. I'm very fortunate. I work with truly an A-plus team. This video is shown in real time. This is a scrub tech who I've done thousands of surgeries with. And what she's doing is she's setting up. So she's first opening all the sterile things onto her sterile field. And notice she has a trash bag set up there on the Mayo stand. All the supplies are there, and she's opening them one by one and getting everything we need on the field. We also use a custom pack so that the one sterile pack that we open does come with most of the things that we need. But we need to open up the viscoelastic, some other little small things that I may use. These are all what you see here. And she's opening them one by one, putting them on the sterile field. Then she'll go out and scrub. Now we've set up for every case with a little bin, a plastic bin that has all the supplies. Then she throws the trash away. She goes out of the room, comes back after scrubbing, puts on her own gown. The circulating nurse is going to help her tie up her gown. She'll put on her own gloves. And this is actually shown in real time. People are actually moving very efficiently here. Now, this scrub tech is truly A+, incredibly smart, incredibly talented, and very, very efficient. And so she gets things set up. That's my gown and gloves she puts to the side. That's the draping she's putting over there. Now she's setting up other materials. She's opening up here. There's her trash bag. Here's the cover for the Mayo stand. All these things come in the custom pack, and you see how quickly she does this and very efficiently puts the drape on. There it is, all over the sides. And then now we'll set up the phaco machine too. We'll get everything going. The entire setup is just 5 minutes, complete. Everything absolutely complete. And so you can see how it makes for very efficient surgery. So here's bringing around the arm of the phaco machine. There's the plastic bag. There's the pocket that she makes here. She's going to spin her gown with the circulator. And then now she's getting other things set up. Here comes the tubing and the vacuum pack that goes into the machine. Now the phaco handpiece is still too hot, and so she's going to let that sit there and cool down and not plug it in until a little bit later. It's fresh out of the sterilizer. So for example, in this room, we can certainly use 3 surgical trays. You're using one surgical tray while one tray is cooking and the third tray is cooling down. So you can have a rotation of 3 trays. You can have more. You can have 10 trays if you want. But 3, I think, is a very bare minimum. We're efficient enough that we can certainly do 3 cataracts in 1 hour in this one OR. And again, we allot ourselves about 7 minutes for the setup, 7 minutes for the surgery, and about 7 minutes for the cleanup and turnover. That's a cycle time of about 20 minutes or so, and therefore 3 cycles can be done per hour. And so she's setting everything up and looking good. The silver tray she brought over are all the instruments that are fresh out of the sterilizer. And so she'll get those set up, let those cool down as well. I'm actually just filming this while she's getting things set up. Normally in this situation, I'd be reviewing my chart. I'll review the lens calculations, double and triple check everything, make sure we're absolutely spot on. I'll also talk to the patient. I prep the patient. I position the patient's head where I want it, set up the microscope. I then tape the patient's head in place. Our circulator right now is actually cleaning the patient's eye with a povidone-iodine solution, cleaning it very nicely, getting that all set up. Our anesthesiologist already has the IV in, and he's giving a little bit of sedation. So by the time we start the case, which is going to happen in just a couple of minutes, the patient's already quite comfortable and in a mild state of sedation. We're using just topical anesthesia, so topical tetracaine, plus we put a little bit of preservative-free lidocaine in the anterior chamber at the beginning of the case. So on the left of the screen there, that's my circulating nurse wearing sterile gloves and doing the preparation. And our scrub tech here is just about done with the full setup. The only thing remaining on the setup now is to get the phaco probe plugged in the machine. And again, she's seeing if it's cool enough. And at this point, she has indicated that it needs to cool down some more. So we'll just wait. But now she's setting up on the Mayo stand all the instruments. Importantly, these instruments are being set up in the order in which we'll use them. So we'll just go down the row here and use the instruments in that specific order. Of course, the scrub tech knows the steps of surgery very well. She has done probably 10,000 or more surgeries. So here are all the instruments in order. Fixation ring, and then side port blade, anesthetic, then the dispersive viscoelastic, then a keratome, forceps, chopper, etc. Thanks for watching.